Thank you for asking me this question. The neurogastroenterology is a specialty, is a sub-specialty within gastro that is becoming more developed, and there is increasing interest in the specialty. The neurogastroenterology focus on helping patients that have conditions that are not secondary to a sinister factor. So there is no, symptoms are not due to cancer of the gastrointestinal tract, and the symptoms are not caused by an inflammatory process. So the symptoms are not due to inflammatory bowel disease, Crohn's disease, ulcerative colitis. The patient's symptoms are secondary to the function of the gut being abnormal. It can affect different regions of the gastrointestinal tract. Some people will have symptoms affecting their esophagus, the food pipe. Others will have symptoms secondary to their stomach not working well, or their bowels. And those symptoms can be caused by conditions that affect the integrity of the nerves and the muscles that control the function of the gut directly, or it can be secondary to conditions like, for example, rheumatological disorders or neurological disorders that in turn affect the function of the gut. And interestingly, although this is a subspecialty that has become more popular and more developed in recent years, the reality is that the majority of symptoms from the gastrointestinal tract that our patients experience fit within the domain and the interest of neurogastroenterology, because the majority of patients who have gastro symptoms are not due to cancer, fortunately, or they are not caused by inflammatory bowel disease. So although it's not a very well-known subspecialty, the reality is that we are able to provide support and manage the vast majority of conditions that can, a great deal of conditions that are suffered by patients with gastro disorders. Yeah. So the function of the gastrointestinal tract is controlled by complex interaction between the central nervous system, the autonomic nervous system, and the peripheral nervous system. And the conditions that affect the central or the peripheral nervous system can in turn impact on the function of the gut. So for example, we have neurological conditions like Parkinson's disease, or like spine injuries, or multiple sclerosis that can present with dysfunction at different levels of the gastrointestinal tract. We also have rheumatological conditions, for example, sclerodermia, that will affect the function of the different regions of the gastrointestinal tract because of their impact on the nerves and the muscle function. And we have also endocrinological disorders, diabetes mellitus, for example, or thyroid disorders that again have an impact on the neural control of the gut. So those would be conditions that have an impact on the gut. But we also have disorders where the main problem, the disorder starts in a particular region of the gut. We have conditions in which there is a nerve degeneration in a particular region, for example, in the esophagus, and the esophagus doesn't work well, or in the stomach. There's this nerve degeneration that makes the stomach not work well, for example, gastroparesis. And then we have a big cohort of patients where actually the function of the gut and the sensitivity of the gut to normal functions, like, for example, eating or opening bowels, is impaired due to external factors, like, for example, chronic stress, or psychological comorbidities like anxiety or low mood, or changes in the gut microbiota. And these are the conditions that are most common in the general population. For example, irritable bowel syndrome. And in these conditions, the function of the bowel is, in the case of IBS, is impaired because of factors like altered gut microbiota, or factors like altered low-grade inflammation of the bowel that can be triggered by mechanisms like stress, chronic stress, or anxiety and low mood. So as I say, there is really a very, very wide range of conditions that can be helped by our specialty, subspecialty. Yeah. Yeah, indeed. So as mentioned before, patients who have neurological disorders that can affect the gastrointestinal tract. There are rheumatological conditions, some inflammatory ones, like as mentioned, sclerodermia or lupus, that can affect the motility of the gut. There are congenital connective tissue disorders, for example, Ehlers-Danlos, that frequently is associated with dysfunction of the gastrointestinal tract. And also all of us, when we are exposed to chronic stress, or we are exposed to following unhealthful diets or unhealthy diets, that can eventually have an impact on the function of the gut and cause symptoms. I mean, that's a very good question, because this is the area of gastroenterology where clinical history and physical examination are absolutely fundamental. A proper consultation should be a long consultation where we explore the clinical symptoms in detail. And that's where the added value of expertise in the field plays a fundamental role. The majority of conditions the mechanism behind the condition and the underlying cause can be diagnosed with a proper and extensive clinical history and asking the appropriate questions. Then, if symptoms are severe and we want to phenotype, so to determine exactly what is the mechanism behind, there are different tests that can be organized to identify the function of the area in the gut where responsible for the patient's symptoms. There are a number of radiological investigations that we can use for patients who have symptoms emerging from the esophagus, or emerging from the stomach, or emerging from the bowel. There are increasing number of tests that assess the function, the motility of different regions of the gastrointestinal tract. And of course, we always make sure that we don't miss any underlying condition that might mimic the symptoms of one of these disorders through appropriate endoscopic or cross-imaging. But what I want to emphasize is that an expert clinical history taking is paramount for the diagnosis of symptoms in patients with neurogastro disorders. And that's where expertise plays an important role to achieve the appropriate diagnosis. So, of course, it depends enormously on what symptoms and what is the mechanism contributing to the clinical presentation. The approach is different if patients have symptoms secondary to another condition like a neurological disorder or an endocrinological disorder. But if we focus on addressing the patient's symptoms, we always recommend an approach that takes into consideration the patient lifestyle, the patient preferences, and the severity of symptoms, balancing very carefully risk and benefits. So the first approach always in patients with symptoms that emerge from the gastrointestinal tract is dietetic advice. Patients might have symptoms because the esophagus is not working well, or the stomach is slow, or the bowel is slow or rapid. And actually we can make a huge difference advising from a dietetic perspective, what are the best foods, the best way of cooking, and the best nutritional options for the patient. There are then medications that can accelerate or slow down the gut, and that can help to address symptoms in a particular region. It's also very important to determine the role of factors like stress and anxiety on the function of the gastrointestinal tract, and vice versa, how those chronic symptoms impact on the patient's well-being. And we can use different psychological interventions that can help the patient to cope better with the symptoms. And also there is increasing evidence that there are a number of neuromodulatory medications that make the relation between the function of the nerves in the gastrointestinal tract to be improved, to reduce symptoms of discomfort, and also to reduce the impact of those symptoms on the central nervous system and on the patient's psychological well-being. So but the approach has to always be an approach that is agreed and accepted by patients. Some patients are very keen on focusing on dietetic intervention, the use of probiotics, trying to avoid medications as possible, but other patients will require a more invasive pharmacological intervention. And finally, there are more difficult cases that will require endoscopic interventions, for example, using tubes for feeding in the more severe cases, or even surgical interventions when the symptoms are very severe. But this will be at the end of the spectrum of the patient's conditions.